So, sir, according to you, is it a very serious problem?
One of them is a very serious condition where we could deal with stroke if we don't address it as soon as possible. If we don't take an immediate action towards this condition, the stroke can worsen and can lead to a significant functional disability.
Yeah. So, sir, is it a ear problem or a brain problem?
Because he had a fear that he will have vertigo. He never slept on bed. He was always sleeping on a chair.
Hello, sir. Welcome to our podcast, Let's Rock with Jagrokhealthcare. Sir, we are very happy to have you here. And, sir, can you introduce yourself to our audience?
So I'm Dr. Reshik Kannan, neurologist, consultant neurologist at Fortis Hiranandani Vashi Hospital. And I have I've been in practice post neurology for 3 years and specialized in vestibular disorders. So that's my introduction. Yeah.
Oh, so thank you so much, sir. Thanks for joining us. So we are gonna start with our topic that is vertigo. So, sir, how common vertigo is in everyday life, and what is vertigo?
So vertigo is has multiple definitions. Now it depends on what the patient is complaining and how the patient perceives the symptoms. In broad, I would say vertigo is something known as spinning sensation.
Right.
And there are two types of vertigo, something known as internal vertigo and external vertigo.
Okay.
Internal vertigo, where patient complains of patient himself or herself will be feeling that patient is moving around
Yeah.
and the objects around are still and the patient is moving around.
Okay.
That is internal vertigo.
Inter-
External vertigo is something where the patient feels that patient is still, but the environment or the things around the patients are moving around. Where the patient complains, this is where the patient says they feel dizzy.
Dizziness.
Right, so this is spinning sensation. That is one thing. Second thing is what some patients complain is imbalance while walking.
Okay.
That is also considered as one of the subtype symptom of vertigo. Third thing is sometimes patient complains of dimming of vision. So these are some subset of symptoms where patient feels they are dizzy, and it is our job to get this data or get this detailed history from the patients and try to categorize the patient's symptoms and come to diagnosis.
Yeah. So, what are the symptoms like earlier symptoms so people can get to know like they have vertigo?
See, the first symptom what they would usually complain is imbalance while walking, as we discussed right now. Imbalance while walking, spinning
Yeah.
sensations, where they feel that they are moving around or the objects around them are moving. And when it comes to symptoms and when it comes to diagnosis of vertigo, we need to find some details about dizziness or about these symptoms which they complain of. Firstly is onset of symptom. When did they start having complaints? When did they start
Right.
developing these complaints? Followed by that, what we need to know is whether these symptoms are persistent or these symptoms are episodic. Episodic मतलब आ रहा है जा रहा है,
Yeah.
right?
Right.
आ रहा है जा रहा है, कितने देर तक होता है, the duration
Frequency.
of symptom,
Yeah.
exactly, frequency of symptoms and duration of symptom is also which is very important when it comes to diagnosis. There are certain conditions where patient will have vertigo and the symptom may last only for seconds. There are certain conditions where the symptoms may last for hours. There are some conditions where symptoms may last for more than 4 weeks. That is
Yeah.
chronic,
Okay.
right?
So long term.
Long term.
So what is the stimuli thing? Like what can trigger
Stimulus,
the?
as in you are talking about trigger,
Yeah.
right?
Right.
Again, very important question. Where there are many conditions where
Right.
trigger of these vertigo symptoms are very essential. When it comes to trigger, the first thing which we need to notice is whether is it positional or
Okay.
is it non-positional. Positional as in there are many patients who complain that they have vertigo when they lie down.
Okay.
They feel with this feel
Spinning.
spinning. For example, I had a patient who had spinning sensation only on lying down position. When they lie down, they were feeling that the roof is moving around.
Oh,
They sit up from lying down position, they feel that this everything is moving. But they are able to do their day-to-day activities, like there's if they have a sitting job, they can do their job. There is no harm in doing that. So these are some positional trigger where they can
triggers.
have,
Yeah.
positions of certain positions can lead to some dizziness, which is very common in something known as BPPV, benign paroxysmal positional vertigo. And
Okay.
most of the patient complains of dizziness when they lie down or
Okay.
when they sit up from lying position. These patients do all their day-to-day activities, they can walk freely, but when lying down or sitting up, they have these symptoms. There are certain there is a condition known as vestibular migraine,
Okay.
where patients do feel some dizziness, some imbalance while walking, but the dizziness or imbalance increases when they move their head, which is known as head motion vertigo.
Okay.
Right. So, of course, triggers of the vertigo are very essential when it comes to diagnosis.
So, sir, according to you, is it a very serious problem? Like,
Again, an important question. Why I would say it's an important question is because
huh?
there are there are many causes of vertigo. One of them is a very serious condition where we could deal with stroke.
Oh, okay.
Vertigo can be a typical presentation or a symptom of stroke, where patient commonly in older individual where they complain of sudden onset vertigo, that is acute vertigo,
Okay.
where they developed symptoms of vertigo within minutes or hours. They suddenly complain of imbalance while walking, and they will complain of spinning, nausea, vomiting, where this there is an indication that we must be dealing with acute ischemic stroke, something known as
Yeah.
posterior
So,
circulation
yes,
stroke,
right.
which is a serious condition. If we don't address it as soon as possible, if we don't take an immediate action towards this
Yes.
condition, the stroke can worsen and can lead to a significant
S-
functional disability.
Yeah,
So
right.
that is one of the serious condition. And when it comes to seriousness, see, vertigo or dizziness is a type of symptom which is very disturbing. Imagine if an individual is having vertigo or dizziness throughout the day, where they're complaining of imbalance
Right.
and dizziness, they're not able to do their day-to-day activities. Of course, it is very disturbing. When it comes to serious condition, I would say acute ischemic stroke of posterior circulation stroke is something which we need to diagnose if an individual has sudden onset vertigo or dizziness.
Right. So, sir, is it a ear problem or a brain problem? How does like we can differentiate between them?
So, the first thing
Yeah.
which we need to differentiate between peripheral, that is, ear
Ear
problem
and brain.
vertigo or brain problem vertigo, when it comes to technical terms and medical terms, we have something known as peripheral vertigo or central vertigo.
Okay.
There are some condition which causes central vertigo, which are brain related vertigo. If there is
Okay.
any brain issues because of which patient can have central vertigo, and there are some conditions which is inner ear problem which is known as peripheral causes of vertigo, that is peripheral vertigo. How to differentiate this? The first thing is history. In history we can get an idea whether we are dealing with central vertigo or a peripheral vertigo. Followed by that is examination. We
Right.
need to clinically assess the examination. We need to know the comorbidities, like if a patient who has a high risk of vascular stroke,
Stroke. Right.
they will have comorbidities like diabetes, hypertension, modifiable risk factor like age, old age individual. So these are some risk factors which will help us to find out whether it is an inner ear problem or a brain
Brain
related
related.
stroke. Again, there are some clinical examination which will help us to find out whether we are dealing with inner ear vertigo or central vertigo. When it comes to inner ear vertigo, it is treatable. And when it comes to central vertigo, of course, if even that is treatable, but central vertigo needs to be detected or diagnosed as early as possible, because when it comes to central vertigo, that is brain related vertigo, stroke is something which we need to immediately diagnose
Right.
and tackle.
It will affect the lifestyle of people.
Vertigo, of course. See, now imagine an individual who is having these dizziness complaints,
Right.
right? Most of the patients who come to my clinic or visit my OPD, they complain of dizziness, which is persistently there. It is affecting their sleep,
Hmm.
it is affecting their day to day activities. They are not able to focus their work. Imagine if they are working on laptop, or if they are working, or if they are any job,
Right.
and they have this persistent feeling where everything is moving around them, or they have this feeling that they are moving around, they are moving and the surroundings are still, they're not able to do their job. Their quality of life
Will be
significantly goes down,
yeah.
right? So of course it affects day to day lifestyle of an individual. Now, as I discussed, I had a patient
Yeah.
who was diagnosed with BPPV, that is benign paroxysmal positional
Yeah.
vertigo, where this individual was not able to sleep on the bed, because as he was about to sleep, he used to have spinning sensation, the roof was moving.
Moving.
This individual had anxiety before. Every
Okay.
night he used to have anxiety because he had a fear that he will have vertigo right now.
Vertigo.
He never slept on bed. He was always sleeping on a chair. Imagine the lifestyle.
Yeah. Right.
Yeah, the lifestyle which was affected because of this symptom, right?
So, is it a age-related problem, or like younger people can also get the vertigo attacks?
So before answering this question, let me just
Yeah.
give a broad idea that what are the common conditions which is affecting vertigo.
Okay.
If I explain this, then
Okay.
I
Relate to
could
that. Yeah.
easily relate to that. Now, the common condition which leads to vertigo is benign paroxysmal positional vertigo,
Right.
something known as, second is something known as vestibular migraine, Meniere's disease, vestibular neuritis, and lastly, I would like to say about something which is not everyone knows about this condition. This is something known as triple PD or PPPD, which is
Okay.
persistent perceptual positional
Disorder.
dizziness.
Okay.
Right.
Dizziness.
Now, when it comes to the condition which I said, vestibular migraine, BPPV. BPPV is something which is commonly seen in elderly individuals, although it can be seen in younger individuals also. The symptoms or this condition can be seen from any patients who are above 18. There are many causes of BPPV. It can be traumatic,
Okay.
right? It can be spontaneous, but older individuals are commonly affected with this disorder. Vestibular migraine is commonly seen in younger individual. Again, patient will have vertigo.
Okay.
So vestibular migraine is seen in younger individual. BPPV is more commonly seen in older
Older.
individual. Of course, as we discussed about posterior circulation stroke, that is stroke can lead to vertigo. Again, that is more commonly seen in older individual. Right? So the age group varies a lot. There is a huge range of patients who can develop vertigo.
Right.
It all depends on the condition which they suffer from.
Okay. The traumatic and
Right. For example, benign paroxysmal positional vertigo
hmm.
can happen in younger individuals, can happen in older individuals.
Okay. So
Right.
it varies through the like age group
Of course, it
and the
varies
reason.
through the age group, because the symptom is can be seen in any group of patients. The condition, the disease which they suffer from, that is seen in particular age group,
Okay.
right?
So, sir, what should someone do if they get vertigo attack? So, what is the like immediate reaction of the like caretaker or something? How can like they?
So when they have an attack of vertigo,
Yeah.
honestly speaking, I would recommend that they should rush to a nearby hospital as soon as
Okay.
possible, because severe spinning or sudden onset severe spinning of things and not able to walk can be an indicator of something serious condition like acute ischemic stroke, where immediate action needs to be taken, right?
Yeah. Right.
So I would recommend that they should rush to an nearby hospital. So And to get a relief from the acute attack, there are some medications which will help to suppress the vertigo symptoms. So those medications can help out. But I think rushing to a nearby hospital is something which I would advise.
Okay. Yeah. So, sir, how common it is like vertigo?
See, when it comes to incidence and prevalence of vertigo, uh, it is quite common. 20 to 30% of general population suffer from vertigo at any point in their lifetimes, right? So it is very common. And the important point is, what about other symptoms associated with vertigo? Now, when it comes to other symptoms which is associated with vertigo, why I'm talking about this specific point is because that definitely helps our patient also to know, to have an idea what they are dealing with,
Right.
and they will get an idea whom to contact if
Contact.
they are having these symptoms. Secondly, it helps us to categorize the symptom and diagnose and treat appropriately. The first thing, the as additional symptoms where you see along with vertigo is headache, something which is seen with vertigo, which is very commonly seen in condition known as vestibular migraine. And there is something known as tinnitus. Tinnitus is there is a continuous abnormal hearing or an abnormal sound perception which is there in
There.
one of the ears, which is commonly seen associated with vertigo in some conditions, in the condition known as Meniere's disease. Hearing loss.
Okay.
Again, hearing loss is something which is seen associated with vertigo. Again, in condition like Meniere's
Meaning.
disease. Imbalance while walking with vertigo can be seen in vestibular neuritis, where the vestibular nerve gets inflamed, and it can also be seen in stroke. Right, so these are some associated symptoms which can be seen with vertigo. Common symptoms,
Right.
right? Yeah.
Then, like, whom they can consult, like, the primary.
Right. Now, this is to the society. I think I would
Yeah.
like to convey this
Address
message to
this.
our society and our community that whenever there is an individual or any relative of yours, if they feel symptoms of vertigo and all those associated symptoms which I discussed with, um, I think the first thing is you need to consult a physician, a neurophysician, or a ENT specialist, because most of the conditions or disorders which are associated with vertigo are dealt by a neurologist or a vertigo specialist, an ENT specialist. And whenever you feel a sudden onset or an acute onset vertigo where you are having imbalance and spinning sensations, the first thing which I would recommend is rush to a nearby hospital so that we take an immediate action and rule out something serious.
So, sir, thank you so much. Sir, we would like to know about your journey.
So, it's a long story. I started my MBBS in the year of
Yeah.
2009. 2009. I did my MBBS, I did my MD medicine, and then I did a 1 year SRship, that is senior registrarship.
Okay.
And during my 1 year in senior registrarship, I was preparing for NEET because I always wanted to, I had a wish of becoming a neurologist.
Okay.
So fortunately, I got a seat of neurology in Jaslok Hospital, Mumbai. I did my DMB neurology from Jaslok Hospital. So 3 years of neurology course, and then followed by that, I started my practice in Navi Mumbai Vashi Fortisira Nandani Hospital. I did a 1 year international course, certificate course in vestibular diseases, and I still would like to further pursue my course in vestibular diseases because I have a dream of of starting a vertigo clinic, and because I feel vertigo is something which is very common, as I discussed that 20 to 30% of patients suffer from vertigo in any point in their lifetime, and something which is not explored, that needs to be explored, and these patients do suffer a lot. There are many patients with vertigo who have these symptoms for months, and they deal with treatable disorders which can be treated very appropriately. So that is something which I intend to deal with.
Thank you so much, doctor, for taking out your time and sharing such valuable insights on vertigo today with us. I'm sure everyone watching it find it useful. And to everyone tuned here today, please like, share, subscribe. And until then, take care, stay healthy.